Okay, good morning once again, and you have entered the virtual room for the School Health Services mid-year training. Again, this is the comprehensive review and compliance portion of our training. Today with us, we have from PCG, John Ward, Rose Jensen, Matt Gillis, and Jennifer Pham. From the Colorado Department of Education, CDE, we have Omar Estrada, and from the Department of Healthcare Policy and Financing, you have myself, Olga Ginchin, and Tracy Gonzalez, who make sure that we're staying on track here today. So we have started recording and we have all of our participants from across the state. So thanks to all of the school districts, BOCES, and community partners who have joined our training today. And with that, I am going to hand it over to Jennifer Pham, who is going to be presenting today. Thanks, everyone.
Thanks, Olga. Hi, everyone. Nice seeing you all virtually. We're going to be covering a bunch of stuff today, so feel free to come off mute or use that hand icon if you have any questions. But we'll go ahead and get started with the program compliance section. So for today's agenda, we'll just go through a brief introduction of Medicaid in schools. We'll talk about in this session, particularly the annual cost report desk review. We'll go into another mind map activity and then talk about those comprehensive reviews, and then just wrap up with some program contacts. So we've included here a list of our frequently used acronyms, so feel free to use this as necessary during the presentation. So we wanted to provide a brief introduction to Medicaid in schools. So as you all may know, districts work within those federal and state laws and guidelines to offer students these unique opportunities to access healthcare via both direct and administrative services. So we have here at the federal government level, we have the Centers for Medicare and Medicaid Services, or CMS, that offers that overall program oversight. We have IDEA, which is the Individuals with Disabilities Education Act, that requires districts to provide students with disabilities a free, appropriate public education, or FAPE, as many of you may be already familiar. And then the federal law also states that the state Medicaid agencies are responsible to pay for those direct services that are identified on a student's medical plan of care in support of the Medicaid state plan. And then we have at the state government side, we have the Colorado Department of Healthcare Policy and Financing. We'll be referencing them as the department. That is the state Medicaid agency that administers the school-based claiming program. The state agencies also work under those CMS laws and guidelines, as well as provides oversight of the vendor's administration of the program. So the vendor for the state is Public Consulting Group, or PCG. And then the department also issues those reimbursements to districts. At the district side, as many of you may already be familiar, you'll go ahead and sign that intergovernmental participation agreement with the state to participate in the school-based claiming program initially. And then funds are ultimately recovered for services provided to Medicaid enrolled students. We wanted here to break up the different entities by roles and responsibilities. So we have here the department, like I mentioned, they are the program policy experts. They enforce those CMS guidelines, provide training administration, so really coordinating today's training. They are also the ones to approve or deny those random moment time study, as well as those cost reporting extension requests. Public Consulting Group, or PCG, is the administrator of that PCG claiming system. They're also subject experts in many program components, such as the random moment time study, as well as the quarterly cost reporting and annual cost reporting, and then also serves as the admin for the help desk, for which is the platform you'll submit any of your questions or give calls into. And then we have CDE, the Colorado Department of Education. They are the reimbursement spending experts. So you'll go to Omar for any of those questions. And then they are also the ones to collect those annual CDE reimbursement spending reports. Stakeholders, they are our experienced regional coordinators with enhanced knowledge in many different types of program components and areas, whether that be transportation, the random moment time study, quarterly cost reporting or annual cost reporting. And they also speak on behalf of district regions in those stakeholder meetings, really gathering your feedback of what's going well in the program and what can be improved, and overall sharing that with the greater group to come up with those best practices. Any questions so far regarding program roles or responsibilities? Okay. Now we'll get into those desk reviews and comprehensive reviews. So really those desk reviews and comprehensive reviews are very similar yet different processes. And we wanted to give you all an idea of really what differentiates both of them. So those desk reviews do occur once you have certified your annual cost report. All districts will go through the desk review process. It is mainly a back and forth conversation with PCG and the PCG claiming system, verifying all of your reported costs and ratios on that cost report. Typically, no documentation is required for the desk review. However, it is helpful to just have that on hand. And then in contrast, we have those comprehensive reviews. So these occur once those desk reviews have been closed out if you've been selected. So really these comprehensive reviews are those in-depth financial reviews that examine all program components. So this is where documentation plays a really big part. You're talking about having that licensure for staff on your staff pool as is necessary, those service logs, attendance records, really all invoices, receipts, reports to support all of your reported costs on not only that annual cost report, but those quarterly financials as well. And so we really wanted to bring up some helpful reminders in these processes. Really, the sooner you complete that desk review, the sooner you can begin the comprehensive review if you've been selected. Really, that process starts from first certifying your annual cost report as soon as you're able to. You do have about 3 months to certify your annual cost report, but please note that if you do take the entire time, you can delay your desk review, which also may delay your comprehensive review. So note that it can span kind of that whole couple of months at the end of the year for your comprehensive reviews to include over those holiday breaks. So really, the sooner you can complete the process, the sooner you can be completed. It's also best to keep clear and organized documentation on hand for ease of reference during the review. This can really play into hand when you're even completing that annual cost report, just having that documentation there so that you can verify and ensure all of your costs and ratios reported during that desk review is complete. And then for those comprehensive reviews, really know where your items and documentation is located at. So it is easy to find during then. And then if you are selected for a comprehensive review, please begin pulling and preparing information right away. It can be best to reach out to HR or your transportation departments ahead of time if you know you're going to be selected for that comprehensive review, just because some of those reports can be timely. So really begin starting that right away and know where things are at so that they are there. We wanted to also provide a summary of fiscal year 2021-22 desk reviews. So like I mentioned before in the previous slide, PCG will conduct that desk review after you have certified your annual cost report. So these desk reviews are really to protect school districts from those federal audits, as well as those potential payback situations by just verifying all of your reported data outside of those expectations. So here we have a table that includes the 9 different types of edits. And then we've included the statewide total edit counts for fiscal year 2020-21, as well as fiscal year 2021-22, and that difference between the two fiscal years. At first glance at this chart, I want to know what stands out to you all. And you can come off mute or type in chat. I'll give everyone a couple minutes to take a look at this. Yeah, so I see a couple in the chat for transportation staff salaries. Yeah, so really wanted to highlight that difference between FY 2020-21 and the difference for that FY 2021-22. So really we see it jump from the 190 to the 657 for transportation staff salary threshold, which is a pretty great difference of 467 edits. I wanted to also point out there were a few other categories with fewer edit counts. So we see the benefits with 0 salary. It did get to 33 in FY 2020-21. And then it did decrease a little bit. So we saw a decrease of about 26 total edit counts for that category. And then we've also seen fewer edit counts for that salary threshold too. So we'll kind of talk about why we see these differences in the next slide. So here, as you all may have noticed, overall, the number of edits requiring your response did increase from FY 2020 through 21 to FY 2021-22. So really, these 3 top increases included 1, that transportation staff salary, the second being those contracted costs, and then the third being the year-to-year transportation, all their costs. And kind of why do we see this really big increase? So these increased edits were due to seeing that nationwide shortage of bus drivers. So really districts had to increase pay in order to even fill those positions. And then districts were largely back to in-person learning. So really the transition from remote back to in-person learning did increase all those transportation costs. And then you see that contracted costs increase as well as more contractors were able to enter schools and deliver those direct services. So that's really why we see these increased edits. And then we do have a few desk review reminders just to help keep your process smooth. So please ensure you're reviewing all data that's reported on each page of the annual cost report to confirm accuracy. So we want to make sure you are thoroughly responding to all warnings and flags with confidence. This also ensures that you're importing and exporting everything correctly, because if you don't respond to those warnings and flags, it can trigger in the system and you won't be able to import all your information successfully. And then all costs reported should also be 100% of your district's costs. So please include those federal funds or non-allowable costs in the appropriate field to offset. It is best practice not to back out those costs yourselves, but when you are inputting those costs into the system, there is a spot to include those federal funds or non-allowable costs, and the claiming system will automatically calculate that out for you. And then also please remember that all costs should be reported based off of when that staff member was listed on the staff pool list. So if you log into the PCG claiming system and you go onto your salaried and contracted costs page, you can reference that green job span bar just to verify your reasonability of all reported costs. So that can be really helpful as well. Any questions regarding the desk review process? I don't think I see any in the chat. So we will move on and do the mind map activity. I'll pass it on to Matt just to introduce this activity, and we'll kind of get into our breakout groups.
Awesome. Well, thanks, Jen. So like Jen said, we are going to be split up into breakout rooms. We'll discuss, but I'll quickly go over what this activity is going to be and what we're going to do. So Jen, if you want to go to the next slide, but what we're going to be doing in our groups is where everyone is going to get their own individual word, similar to how that school health services program manual is in the center. And then as a group, we'll just discuss some branches and connections that we tie to that primary role of the program. So anything that comes up, anything that's involved with that process. And again, it'll make a little more sense when we have your words to go off of, but we'll spend a couple minutes in a breakout room that Tracy is going to split us up into. We'll discuss that, and then we'll come back to the larger group just to share some of those connections that we made. If there's any questions, feel free to ask your facilitator maybe why that branch is tied to our core word, and then we can also discuss some of those in the larger group as well. So if there are any questions, feel free to ask the facilitator in your breakout room. But Tracy, I think we're good to be split up and go out and talk. All right, if we have everyone, then we will go down the list for a couple. I'll just rattle off who I had on my list. So John, your group had annual cost report. So whoever your spokesperson was from your group, if they want to come off mute, share a few things that they had written down, any questions that came up.
Yeah, so our word was annual cost reporting, and Jesse was our spokesperson.
So the words we came up with, the annual cost reporting include the accrual accounting, transportation, which is specialized and not only specialized, the one-way trips, the IEP ratio, payroll and contracted staff costs. It opens on August 1st of each year and is due by November 1st. It also includes free care, direct service was one of the things mentioned. And I believe that was it. There were no questions.
Awesome. Sounds like you all had a pretty lively group. Anyone else have any questions on any of the things listed off from that annual cost report group? All right, so next on the list I have is my group. So my group had quarterly cost report, and Letitia will be our spokesperson. So if you want to come off, rattle off a few of those items we had, and then same thing if there's any questions.
All right, so we talked about cash basis accounting, the development of staff pool list, other costs for quarterly report, professional development, travel and training, contracted costs, salaries and benefits, MER. There are 4 quarters for the report to get reimbursement. It's necessary to sign the CP form, which certified public expenditure, and then the federal reimbursement. That's it for us.
Thank you, Letitia. Any questions from the larger group on those? Anything anyone else wants to bring up?
Leticia, can you expand a little bit on the federal reimbursement part of it? I'm testing you.
Do not put me on the spotlight. But I mean, holy moly, okay, there is the direct Medicaid percentage. Is that what you're looking for?
No, when you were talking about the federal reimbursement, so I just wanted to expand a little bit on that as it relates to quarterly and the percentage. It is a state and federal program. Those dollars come from, they are federal matching dollars. Can you tell me what the percentage is for that? It's pretty easy. So it's 50%. And, sorry, I didn't mean to put you on the spot.
That's okay.
Yeah, the federal financial participation rate, and it's at 50%, and it will always be at 50%. It doesn't go wanted to highlight that real quick. Thank you, Leticia.
Awesome, and thanks, Olga. Next on my list is going to be our group that was with Rose, and that would have been the random moment time study. So Rose, who was your spokesperson?
Hi, Matt. I'm the spokesperson, but I'm going to rely on Marley because she was our scriber. But we had the others participate by chat, so I didn't want to put everything on Marley. So we had RMTS, and we talked about the two different cost pools that make up the staff pool list. We talked about the random moment time study being the driver of reimbursement for the program, because the costs reported for both MAC and annual cost report come from the staff pool lists of the participants. I forgot to mention my group kind of killed this one at the onset. My group also talked about moments, how they have to track down and get people to answer their moments. Obviously, the time study issuing all those moments is again the driving force. And then we talked about shoot, I'm blanking. What else did I miss, Marley, on your list?
We discussed calendars and our sample schedule.
That's right.
And all of the various cost reports that come out of RMTS. And then Rose, you reminded us that not only did RMTS replace the old fee-for-service methodology, it also replaced those timesheets and tracking from our providers.
That's right. That's right. That was great. We talked about, they brought up calendars, which is great, and how folks are sampled based on the time they're available per the calendar that they mark. So that was something great that the group brought up. And then, yeah, we just kind of went back to the history of why we even do the random moment time study. So again, we had good conversation.
Awesome. Well, it sounds like there's a lot of good discussion in there. Definitely seems like you all hit it all. So we then will move on to our fourth group, which Olga led for billing. So hopefully you had some good discussions in there.
Yeah, we had Yang as our spokesperson. Yang, did you want to come off mute and list some of the things that we talked about?
Yes, of course. Hi, good morning, everyone. So in our breakout team, we talked about eligibility and who is enrolled. And so then Olga mentioned that for billing, she only sees like kiddos enrolled at that school. And then what billing was related to. So direct services, medical services, healthcare plans, and if it met the requirement, then there's also subcategories to that, which was scope, duration, frequency, eligible health, and then we can bill for that. So that's it.
Yeah, and I would add to that I'll be talking more about that in my portion of the presentation in our virtual training session later. So definitely have some things to talk about related to billing this time around, and can go more in depth when I talk later. So thank you, Yang.
Well, thank you, Olga and the billing group. And then we have Jen, who covered comprehensive reviews with her team.
Thanks. And Christina is our spokesperson, so I'll hand it off to her.
Yeah, so we had kind of a small group, and most of, I think, 2 out of 3 of us had been through a comprehensive review, and then another member of our group had not experienced one yet because they were newer in their role. We had all experienced comprehensive reviews when we were newer in our roles, and kind of our takeaway was actually that it was a pretty positive experience, because the findings really help you recognize strategies for how to be organized with overseeing and managing your program. Basically, you want to save everything so that if anything is kind of brought up and questioned, you're able to produce that documentation, whether it's related to claims or consents or provider licensure, or direct medical costs. Those are all areas that they look at. And, just really making sure that you're organized and that you're able to produce those things. But typically it is a great learning opportunity for most folks. And yes, it's stressful, but if you are organized, it can be done and beneficial to your process moving forward.
Great, thanks, Christina.
Awesome, thank you. And definitely like that you see the comprehensive review as a learning process, because that's what we really just hope to get out of it. So at least someone else shares our sentiment there. And then finally, we had Omar, and with his group, you covered the RSR. So if you want to take it away, Omar.
Yep, we had our spokesperson, Andrea, if you want to jump in and just provide a quick overview.
Yeah, so we talked about that this is the report that's due to the CDE by the end of February, and it covers how you spent your reimbursement money. Some of the topics we talked about was the difference between your health-related costs, so that'd be like your salaries for your nurses, SLPs, those things, compared to potential admin costs like going to conferences. Those were kind of the main things we talked about.
Yep, and we weren't able to get to it, but a key component of this too are those parental notifications, which are also connected to those parental consents. So that's also something to keep in mind as well.
Awesome. Well, thank you guys. Yeah, so just hopefully this activity made you guys spark some conversations, think about what ties into each of those program areas. So Jen covered comprehensive reviews, but we'll be talking about everything else that we covered in the various breakout rooms. So be able to go into a little more depth if you didn't have any ideas of what to come up with branches. So hopefully spark some questions later on in the other presentations. And then also just seeing how large of a program this is, how many different fields there are, and how they all end up tying together. So just understanding that there's a lot that meshes into the program, different things to think of, different ways to improve, and always things to learn on. So Jen, I will pass it back over to you unless we have any final questions or comments on our mind map example and activity. All right, close us out then, Jen.
Thanks, Matt. So in terms of the comprehensive review, we wanted to kind of take our common findings for fiscal year 2021-22, and here were the top 3 findings. So really wanted to highlight standard 1A, which is the salaried and contracted staff, as well as standard 3, which is similar, but with the quarterly financials. Our findings in these 2 categories were just over-reported costs. So really tips for the annual side when you are reporting those salaried and contracted staff is to make sure costs are reported using the accrual accounting method. So really based on dates of service. Whereas when you look at your quarterly financials, costs are reported using the cash basis method. So dates of payment. And then the third category, we also saw some findings in where it's standard 1E, so those transportation other costs. You can think about this as items that typically make the bus run. So we're talking about maintenance and repairs, fuel and oil, all those things. So really our findings in this category included missing invoices or receipts to support each of the different categories. And really some tips for this is just to make sure that you are breaking out all those costs by the different categories. And then please ensure you're always using those system generated reports. We have a few comprehensive review reminders as well that can go on both the annual and quarterly. side. So really, you should all be maintaining all documentation as it is a program requirement. So this includes everything such as licensure for staff where appropriate on that staff pool list, service logs, those IEPs, as well as other medical plans of care, the student attendance records, and then all of your receipts and invoices to support your reported costs. Along with that, you should also understand and report all allowable costs, including those pay and stipends associated with the primary job function. So please remember that reimbursement received from the program is considered state and local funds. And then all of those general stipends or bonuses are considered allowable. So we've seen things such as COVID-19 bonuses or retention stipends that you can report and are allowable. And then also remember that the School Health Services Program fiscal year does run from July 1st through June 30th. So your districts may operate on a fairly different fiscal year, but ensure when you are pulling those reports for staff that they include this time frame as necessary. And then make sure that all of your financial documentation includes account codes for source funding, those salaries and benefits broken out, and then any unsubstantiated costs removed unless your district can provide supporting documentation to prove otherwise. So really, please keep all of these in mind when you're going through that comprehensive review, as it can make that process run a little bit easier. Any questions regarding the comprehensive review? Or any districts have gone through this process and have any tips? Feel free to unmute or go on chat. All right, well, if no one has anything, oh wait, I see a chat. Yeah, so Marley mentioned to be careful about the COVID stipends and ESSER. So yes, that is definitely a good one to bring up. ESSER funds are considered those federal funds, so please make sure you're putting that in the correct spot when you're reporting. If they are just regular COVID-19 stipends that come from your general fund, you can still report that. So thank you, Marley. But with that, if anyone else has anything, we can end the section. So we wanted to wrap up with some program contacts and some resources. So if you haven't already, I highly recommend bookmarking the department's website for the School Health Services Program. You can find a bunch of materials and resources there, such as the program manual, stakeholder information, and then we've also included a PCG claiming system. So here we're going to have all of these presentations uploaded. Here you can also find user guides as well as the program calendar, and then any items related to trainings. And then we've also included our contact information. So we have Olga with the department, as well as Omar with CDE. And then we have the annual help desk, as well as that RMTS and MAC help desk contact information here as well. But thank you everyone for joining this presentation. And I'll go ahead and stop sharing. If anyone has any last minute questions, we'll stay on here for a little bit.
And if you don't have any questions, we'll see you at 10:30 for the CDE and department portion of our virtual training today. Thank you, everyone.
See you soon. Bye-bye.
See ya.